Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
I get two camps of responses. I get my coders and auditors who are really thrilled with embracing the gray area of ICD-9 coding, and then I get my others who would prefer much more to stay in their CPT realm of procedures. I think the real challenge when it comes to ICD-9 coding is that so much of what you're relying on is the clinician's documentation. And unless you have really good, strong documentation, it's very hard to understand as an auditor what is correct as far as the coding that's there and what's incorrect. I find that the providers who come in and do what I call breadbasket ICD-9 coding can be a real struggle as far as from an audit or coder perspective. These are the physicians who throw in every diagnosis every time across the board. And you really have to struggle once you get into the note to understand, is that ICD-9 code really warranted for that encounter or not? And certainly when we talk about risk adjustment, we need to make sure that while we're addressing those chronic problems that we're actually seeing that in the documentation. So we're going to go through today and look at some real points of what to look at when you're looking at diagnoses. We're also going to bring in the ICD-9 coding guidelines. That's what adds an extra depth to ICD-9 coding. And when you look at your CPT book, yes, you can go and look at CPT assistant articles to help you, but a lot of the guidelines and that official information is right there next to your code level. When you go to ICD-9 coding, you have to really pay attention to those, if you're using a book, front part of your book where it has all the ICD-9 coding guidelines broken down by chapter and how that's grouped to your particular codes. And if you forget to use that or to cross-reference and go back to it, it can be a real challenge to actually make sure that you're following correct coding guidelines. So why does diagnosis coding matter so much to us? One word tells us why it matters for HCCs, and that's money. The quality of diagnosis coding and supporting documentation affects how much money the plan pays for that patient. So if we don't have the documentation to match, and that's found from a CMS audit, then we're subject to having to pay that money back in the form of our premiums are going to be reduced. So we're not going to get as much money for that individual patient's care as we would if we had actually correctly coded those charts. The goal of ICD-9 coding for HCCs, whether you're working for a plan or a provider, is for the documentation and coding to accurately describe the patient's health status. And this includes that the provider must fully assess all chronic conditions, and that has to be done annually. So in the beginning of the chart, you're going to see your chronic conditions that are being treated at that visit. Now, hopefully you're using in the very beginning the whole list of the patient's chronic condition list so that you always have that in the front of your charts to be able to refer to. And then making sure that at least once annually for any reported chronic condition that there is an actual assessment in one of those charts of that being evaluated that year. And then finally, part of what our requirements are as well for proper HCC coding is that we code to the highest level of specificity and follow all ICD-9 coding guidelines. So you're really being pinned down by CMS to make sure that you're using your ICD-9 codes correctly, especially since that's driving the payments. So let's look at how this affects one typical HCC grouping that we have, and that's for diabetes. Diabetes is interesting because it's one of the few diagnoses that actually span a number of HCCs. So typically when you look at something like COPD, there's a 1-to-1 ratio where the COPD is always going to one HCC. There aren't multiple categories. Diabetes is one, I believe, the actual only one that
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.